I can confirm we're now live, so we can start the meeting.
Thank you, Marie. Good afternoon, everyone. My name is Liz Fairhurst. I'm the Executive Member for Adults Health and Care, and I'm sitting next to Councillor Warwick, who's
Executive Member for Young Adults Health and Wellbeing. Thank you.
welcome to this decision day. And I'd also like to say welcome to Sally Ayscough, CEO of Solar Mind, who's here to make a deputation. It's on the first item on the agenda, which is reducing the Hampshire County Council's contribution to wellbeing centres as part of our savings programme for 2025. Sally, you have 10 minutes to speak as per our deputation procedure. I will listen to what you say and take it on board in relation to the proposed decision. However, I will not enter into discussion with you about it. Once you have finished your deputation, I will move to ask the officers present to explain the proposed decision to which your deputation relates. Once this item is concluded, I ask that you leave the call, and should you wish to observe, you can access this on via the live webcast on County Council's website. So, shall we go over to Sally?
Thank you, Councillor Fairhurst. So my name is Sally Ayscough. I am speaking on behalf of the Hampshire Mind HIP to represent Solar Mind, Andover Mind and Habitat East Hampshire Mind. We have concerns about the reduction of funding for the mental health wellbeing services in Hampshire at our wellbeing centres. And as Councillor Fairhurst, as the executive lead, not to give approval to the proposal. Councillor Fairhurst, we strongly believe that these centres offer essential services by providing safe spaces for your residents to receive emotional support and attend workshops, courses and activities during times of need to support their mental health. 1 in 6 people have common mental health problems such as depression and anxiety at any one time. With the rising cost of living and cuts to vital services, mental health needs are increasing. The Centre for Mental Health estimates that 10 million people in England will need support for their mental health as a result of the direct result of the pandemic over the next 3 to 5 years. People taking their own life in Hampshire is also sadly on the rise. Hampshire County Council must take a proactive approach to improve the mental health of Hampshire residents. Our wellbeing services not only benefit Hampshire residents and help meet statutory duties, but also reduce the burden faced by your statutory services, particularly children's services. We know our interventions keep children out of care, and I will share an example later. This saves money. A benchmarking exercise on behalf of Poor Cities UK found that the average cost per looked after child was almost £38,000 in 2017. If just 17 more children go into care as a result of our service diminishing, that will wipe out the entire savings that is proposed. In the Hampshire area alone, last year we helped 111 Hampshire residents with children of school age or younger, with at least 15 children having children's services involvement. Mental ill health can lead to other problems in people's daily lives, such as housing, money, work and benefits. Our wellbeing services are centres to keep people well and to generate cost savings elsewhere. I'd now like to particularly point to the 8 points raised in your report paper submitted to the committee. And I start with point 6, where it states that Hampshire County Council does not have a legal duty to fund these services. We strongly believe that it does have a legal duty to not disadvantage residents with poor mental health under the Public Sector Equality Duty of the Equality Act 2010. Equally, under the Care Act 2014, the Council has a duty for suicide prevention and promoting individual wellbeing. I now turn to point 66 in the report, where the Hampshire County Council consultation illustrated that 41.7% of respondents value group work, and a third referenced one-to-one work as important to their mental well-being. The report recognises that people who use the service value a mixed economy of service provision. From our wellbeing staff perspective, we know one-to-ones are important in ensuring the right support is given, particularly to people with more complex needs. You cited that the mixed service provision would be preferred, and we agree. We also know that the needs of the community should be considered. But the reality of the scale of the proposed budget cuts is that we will not be able to continue to provide the current level of one-to-one provision, meaning people with more complex needs may not get the level of help they need. We also know that it's likely to create much longer waiting lists, impacting accessibility and outcomes for people across Hampshire at a time when support is rising. Or waiting lists are already high across all services, including this wellbeing contract, where in some of our centres we have over 100 people on the waiting list, waiting up to 8 to 10 weeks to access services. The cuts proposed will increase this pressure further. And we also know that GPs have also got long waiting lists, and we do not believe that these impacts have been mitigated effectively. Point 70 in the report notes that a formal equality impact assessment has been carried out on these proposals, and this has found that the proposed reduction of funding may have a negative impact on people with mental health issues. We believe that the equality impact assessment for the full £132 million cuts, and not just those to our wellbeing service, will have the greatest negative impact on people with mental health issues. And we believe this needs mitigation. There is no mitigation to date, and Hampshire County Council is proposing to cut the very service which is the mitigation. From the responses you shared in the report, residents have been saying the same. Accessing the wellbeing centre is important in helping an individual to maintain their mental health and emotional wellbeing, to be able to live a life and contribute to the wider community. And any change or reduction to wellbeing centres would increase mental ill health. Point 76 in the report cites that the adult social care funding be removed from the contract, then it is likely that the service will require remodelling by the remaining partners. The feedback from the engagement exercise which was undertaken with people who use the service to determine what people value most from it would be shared with co-commissioners to help inform ongoing discussions about service design. But your report has concluded that cuts will have a significant negative impact on people with mental health conditions, and in particular those with protected characteristics. We would suggest that your mitigations do not go far enough to explain how these will be effective in preventing impact on those most vulnerable. Point 77, the report states that there will be opportunities to increase the use of volunteers. We accept this and we want to use more volunteers, but this cannot be considered a like-for-like replacement with employing staff. Despite acknowledging the disproportionate impact on vulnerable groups, such as those with protected characteristics in your assessment, the Council is currently proceeding with the cuts without a robust review of the critical one-to-one services which are essential to maintaining the mental health of the community. Volunteers are a helpful asset to our services and help run peer groups, but would not be appropriate to offer one-to-one support. To conclude, I ask you Council purpose as the Executive Lead to reject the proposed cuts on behalf of your residents. These cuts are vital to the residents you represent, and your own equality impact assessment for the 132 million cuts tells us that the most disadvantaged will be those with mental health. You have a legal duty to mitigate this impact. By cutting the service, you are not meeting your legal duty, as the service is required to mitigate the full effects of the cuts you are proposing. I will leave you with this true story of one of your residents who used our service. We have changed her name. Please meet Ella. A single mother, Ella, found herself entangled in a web of challenges that seemed unsurmountable. Life had not been kind to her. With 2 young children under her care, the weight of responsibility was overwhelming, especially as she grappled with poor mental health, a history of substance misuse, and the lingering shadows of domestic abuse. Her child was placed on the Child Protection Register, a stark reminder of how precarious the situation had become. Emma's journey to reclaim her life began when she was referred by Hampshire Council's children's team to one of our wellbeing centres and the services we provide. Recognising the urgency of her circumstances, a comprehensive one-to-one mental health assessment was swiftly conducted. A meticulous support plan was crafted. This plan was not just a piece of paper, it was a lifeline, offering Emma a chance to rebuild her shattered world. The one-to-one support Emma received was multifaceted, addressing both her immediate needs and long-term well-being. We also provided Emma with courses designed to equip her with the tools needed to manage her mental health and rebuild her confidence. The transformation in Emma's life was profound. She became an active participant and support network that extended beyond her immediate family, finding strength and solidarity in a community of individuals who share similar experiences. Her relationship with her children blossomed as she learned to communicate more effectively and provide a stable and nurturing environment. The impact of the support from our services at the Wellbeing Centre, both group and one-to-one support, was evident. Children's services were downgraded to support children's status to children in need, SIN, a clear indication of the positive changes in their lives. Emma's journey to the depths of despair to a place of stability and hope is a testament to her own resilience and the power of comprehensive support. Emma's story is a powerful reminder that even the most daunting challenges can be overcome with the right support from our Wellbeing Centre and unwavering determination. This is just one of thousands of stories we see every year. Thank you for listening, and Councillor Fairhurst, as the Executive Lead, please do not give your approval to these proposed funding reductions, and instead support your residents like Emma in Hampshire. Thank you.
Councillor Fairhurst, you're on mute.
Sorry, we seem to have to manually do it on the screen as opposed to on our little thing. Thank you for that, Sally. But I will now move on to Jason and ask him to present his report.
Jason.
Sorry, thank you, Councillor Fairhurst. I'll proceed with a summary of the report. Thank you, Sally, for your information and looking through the report. I must introduce myself. I do have a terrible sore throat, so I'm hoping I'll be able to get to the end of this, but hopefully I'll be okay. So, as we've seen, this report describes a proposal to reduce the county council's funding for the mental health wellbeing services from £1,281,777 to £625,000 from the end of January 2025. And as referenced, this is one of a number of savings proposals within the savings programme for 2025, which is there to address a forecast budget gap of £132 million in the 2025-26 financial year. This proposed reduction would mean an overall reduction for the services from funding reduction from £4.94 million currently to £4.28 million per annum, which is a 13% budget reduction. And this reduction would be the contribution from the adult health and care budget, whilst the council would continue to provide funding for its public health budget. Currently, Hampshire and ICB are by far the biggest funder of this service, it's about £3.54 million per annum, and Friendly ICB also contribute just under £117,000 a year. The reference to legal duties, that there is no specific legal duty to provide these services as stated. There are no Care Act eligibility requirements to access the service. and the analysis shows that people who access the services are not ordinarily referred from adult social care sources. Most of the referrals are from NHS providers. The current wellbeing services contract started in September 2022. The current provider, as Sally said, is Hampshire Mind, which is a community interest company, which is a limited company which exists to benefit the community rather than private shareholders. Services delivered from 13 wellbeing centres across Hampshire, and these are non-clinical settings with a wide mix of activities. From one-to-one support for people with very complex needs and wider group activities, all of which are designed to support people their recovery from mental health issues and helping to promote, support and maintain mental well-being. Some of the sessions, this is an exhaustive list, but there are sessions which are focused on things like anxiety management, low mood, emotional coping skills. There are focus groups such as men's groups and groups of younger people. There are quite lots of creative workshops, things like arts and crafts, and also activity-based groups, things like yoga and walking, which promote that sort of wider mental and physical well-being. And the services themselves are all part of a much wider ecosystem of mental health provision in Hampshire, which includes the access to core NHS mental health services. And those other services we've outlined fairly briefly in sections 20 to 40 of the paper. The proposal was first aired to the Chief Executive Mind organisation prior to the making the money consultation in summer 2023, and individuals and the organisations themselves were invited to give feedback as part of that consultation exercise, which is outlined in section 60. Following that, we undertook a further direct engagement exercise in February and March of this year, which asked people to identify what was the most important element to them in their attendance at the services. And we received a really high level of feedback from that exercise, which again is summarised in section 64. Our partners in Hampshire and Isle of Wight and Frimley ICBs and our Public Health Commissioning colleagues have also been engaged early and have had some time to consider the potential impacts of this proposal. However, partners understandably have been sort of reticent to do too much detailed planning because they don't want to preempt the decision. Certainly there have been some conversations occurring already. If the decision is taken to reduce the funding as proposed, we are proposing to provide a 6-month notice period, and this would allow time for the reference redesign work and how partners want to utilise that remaining £4.2 million per annum, how that should be delivered in the future. I think we need to be transparent that this is a reduction of funding. It cannot be completely mitigated. It is likely to mean some reduction of service capacity and activity. Our belief is that there is good potential for partners to remodel the wellbeing services to some degree. And Sally also referenced the potential use of volunteers, albeit we know there are some challenges to that, certainly post-COVID in terms of volunteering. I would note that peer support is already a really kind of strong feature of the service delivery. The information we received is that all of the centres would remain open, and the ongoing £4.2 million per annum would enable that. We're also proposing that HCC and Adult Health and Care Commissioners from my team would continue to hold the contract and to manage the contract until the end of the current contract term in August 2025. That would allow our partners to focus on that redesign element. Those other technical bits, we continue to offer that service. We're also proposing Hampshire County Council currently provide 2 premises for notional rent levels, and we're proposing to carry on that arrangement what's needed. The Equalities Impact Assessment has been referenced and can be found attached to the report. Again, in the interest of transparency, we have identified that this as a budget reduction would have a negative impact on people who use the services. most obviously on people with an identified mental health need. It should also be noted that people with other protected characteristics are generally and proportionately more likely to experience mental health issues than the general population. So we have identified potential impacts there as well, across the broader range of protected characteristics. However, taking that into account and taking into account that there will still be £4.2 million a year of funding available for this service, the recommendation from officers is that the lead executive member for older adults and public health and wellbeing approves the proposed budget reduction, and that the County Council modifies the relevant contract as set out in the report.
Thank you, Jason. Are you ready to take some questions?
Absolutely, yeah. If my voice holds out, I'll answer as I can.
Councillor Warwick.
Yes, thank you, Councillor Fairhurst. And can I just thank Sally for her presentation? I visited one of the wellbeing centres, and they're attractive, and they've got the high street location, which makes it very easy for people to attend. But we all know that adult social care and children's care takes a big chunk of the Hampshire total revenue budget, about 2.6 billion. 80% of that is covering our children's and adults services, and everything else we do is kind of squashed into that 20%. So we're really aware we're under massive pressure and looking at absolutely everything we do. Jason or Graham, can you explain, you mentioned that the mental health ecosystem, and I just wondered how that has changed in terms of funding since the pandemic. Are we seeing increased funding from the ICBs towards mental health, which this actually sits within their space probably more than us, although we do continue to fund by public health. But are we seeing a change in that? Or you sort of mentioned the ICBs, and I'm not too sure how certain we are about what they will and won't do.
Yeah, thank you.
To answer that, thank you.
Thank you. I'll ask Jason to add some detail to what I'm about to say, but what I'm about to say is at a general higher level. So as you've heard, these are non-clinical services, and clearly what we've seen over a period of time is investment into mental health services under parity of esteem has increased progressively and indeed quite markedly, and that sits typically out with NHS provider organisations. And Jason made reference to that broader ecosystem. That broader ecosystem across Hampshire and indeed nationally has seen increased funding since the pandemic, and indeed a little bit in advance of the pandemic as well, given national lobbying in terms of the importance of supporting people's mental health. Jason, can you just add some detail in terms of what we understand is the investment into mental health services, clinical mental health services across Hampshire and the Isle of Wight?
Yes, certainly. In terms of these services, Councillor Warwick, the ICB's contribution has increased significantly in this latest contract. These services have been around since around 2012 in some shape or form, and previously the Hampshire County Council and the NHS were broadly comparable in terms of our contributions. When this new contract started in September 2022, the NHS funding contribution almost tripled, up to the current £3.5 million from Hampshire and Isle of Wight ICB. The NHS is committed to something called the Mental Health Investment Standard, which is a requirement from NHS England to proportionately increase their funding for mental health services year on year, linked to the overall increases in funding being made available. So the requirements for the NHS to invest in mental health are a lot clearer and a lot more robust now than they certainly were a few years ago, certainly pre-COVID. We also have seen, certainly from our perspective, a huge increase in terms of what we spend, and which you have referenced in terms of our revenue budget. So for people with an eligible social care need, the adults health and care spend has increased significantly again, particularly since COVID. It's almost doubled in terms of mental health budget.
Thank you very much.
Yeah, Councillor Menahan.
Thank you, and thank you, Sally, to your presentation. I have a couple of questions, if I may. Can we confirm, I think you mentioned this, Jason, can we confirm the health and wellbeing centres stroke places of safety are all to remain open? And in addition to this, are we aware of any proposed changes to the service provision going forward? Thank you.
Thanks, Councillor Meehan. So the information to date is that none of the centres would be closing due to this proposal. There is something happening up in the northeast around one of the locations, which was kind of happening already, just in terms of the rent levels. Another venue has been sourced there. I think it remains to be seen exactly what the impact would be, and I think that comes back again to that requirement for that redesign work, and the fact that the partners have been understandably reluctant to get too in depth and to make any decisions pending this decision. So it really hinges on the decision today, I think, and but certainly there have been a number of preliminary discussions, but nothing tangible as yet in terms of something that we could articulate in terms of this will be the exact impact.
Thank you. And my second question is, if the decision to remove adult social care funding is undertaken, what is the public health financial contribution that will continue to support this service? Thank you.
So just going back to the report, the public health contribution would continue, and that would be at £625,000 per annum.
Thank you. That's all I have. Thank you.
Thank you, Councillor Meehan. Councillor Withers.
Thank you, Sally and Jason, for your presentations. I have a couple of questions also. You've mentioned, Jason, out of the 13 wellbeing centres remaining open, that 2 of them are owned by a county located in Basingstoke and in Eastleigh. As the market rent values and maintenance costs provided by county is approximately 45,000 per annum, is there any intention to raise the rent on these 2 centres?
Currently, there's no intention to start charging rent to the mined organisations. That's not our intention at the moment. They are provided for notional rent, and it's proposed that would continue. That would be part of our ongoing offer in terms of supporting the service. There is also potential to have a conversation with colleagues within Hampshire 2050 and the wider council about other council premises, and if other premises might be appropriate for service delivery, which could assist the service in the future. That could also be a conversation, something we may want to look at.
Thank you. And my second question is, I mean, you've confirmed that despite the withdrawal of adult social care funding elements, adult health and care will continue to hold the contract management of the mental health wellbeing services until the end of the 3rd contract year, 31st of August 2025. Can you confirm without any charge to the partners?
That's correct. Yeah. So we currently that is the current arrangement. So we already hold the contracts and we provide contract management. We don't receive income for that. Something that we have done historically. So that would continue at least until August 25.
Thank you. That's all.
Thank you, Councillor Withers. Thank you, Jason. Your voice held up really well. So what I'd like to do now is I'd just like to take perhaps a 5-minute break while I think on everything that Sally said, everything that you've said, and what people have asked questions on. So can I thank you all very much and ask perhaps Marie, could we stop the recording for 5 minutes and then we'll come back? Thanks, Sally.
Thank you. Please pause the webcast and we'll adjourn the meeting for 5 minutes. I can confirm the webcast has restarted.
Thank you, Marie. Let me start by thanking Sally for her deputation and to reassure her that we are in no doubt about how valuable the wellbeing centres are to the residents they affect. Jason, can I also thank you for your presentation, for the answers to the questions, in spite of your problems with your throat. Was that from watching football?
No, I'm afraid it's illness, I'm afraid.
Okay, thank you anyway. As Councillor Warwick said, Hampshire County Council's financial position is on public record, with a £132 million shortfall predicted for 2025-2026. We do have a legal duty to deliver a balanced budget, and therefore, as an authority and as Adults Health and Care, we are facing some really difficult decisions. I'm delighted to learn through Jason's presentation that actually no centres will actually close and that the public health grant will continue, which is well over £500,000. I also note that we are continuing to hold the contract and continue to provide contract management of the mental health wellbeing service until the end of the 3-year contract term. Adults Health and Care will be providing this service without charge to partners, and actually, even if we can't provide all the money people would like, we are providing in kind by doing this and giving buildings a peppercorn rent. So taking that all into consideration, I think I will go with Jason's recommendation that the Executive Lead Member for Adult Social Care and Public Health provides approval to reduce the annual contribution of Hampshire County Council by £656,777 per annum over the remaining total life of the contract to August 2027, and to modify the relevant contracts as set out in this report. So thank you, Jason. As I say, we have difficult decisions to make, and this is probably one of the more difficult ones, but we do have to protect our services to the most vulnerable in our society. Thank you.
Thank you, Councillor Fairhurst.
If we move on to adult community care, including domiciliary care, updated contracted arrangements. Is that Gail? Is Gail here today?
No, it will be Denise.
No,
Denise and Stephen between them, I think.
Yes, thank you.
It's Stephen.
Thank you, Councillor Fairhurst. I will provide a summary of the report and then take any questions that people may want to ask. So, the County Council commissions a range of services to meet the assessed needs of people in their own home. Remaining independent as possible at home is one of the County Council's 3 priorities for adults' health and care, which will enable Council's vision to help the Hampshire residents live long, healthy and happy lives. We do this through purchasing a range of appropriate services, including domiciliary care, which is care delivered in a person's own home by visiting carers, extra care services, Take a Break, which is a service for carers to take breaks from their caring responsibilities, living care, which is similar to dom care, where an individual carer lives with someone in their own home, and some reablement and short-term services. This is currently done largely through a framework of provider contracts, which was put in place back in 2018, which means we're able to purchase the care people need across all parts of Hampshire. The current framework is due to end in August of 2024, and while we'll still be able to purchase care for a good while after that, we need to look at how we continue the good work, ensure that we continue to buy the care that people need in the right way. We know that the population is predicted to increase, with highest predicted growth expected to be those aged over 75 and over. Given the growing and ageing population alongside increasing complexity of needs, the County Council anticipates that demand for these services will remain high and is likely to increase. Any future arrangements therefore need to be able to be flexible enough to meet changes over the next few years, but whilst also giving the market some stability and surety how we're planning to work with them, and by putting something in that can last. The spend and contractual arrangements proposed within this report, therefore, would cover a range of services, including but not limited to domiciliary care provided for older adults, but also for the first time bringing in the option to purchase care for working age adults with a learning disability or mental health condition, extra care services for older adults, take a break as previously mentioned, regulated living care services, both short and long-term care arrangements, reablement step up from the community or step down from hospital short-term services, and also services purchased by or on behalf of the Hampshire and Isle of Wight Integrated Care Board. Overall, the current arrangements we have work well, and the proposal is keen to stress the importance of maintaining the good practice that's already in place to source care for people in the future. There is, however, always an opportunity for continuous improvement and building on that success of previous arrangements. Therefore, the strategy outlined in this report is to implement an updated but very similar arrangement to what we have now, with changes only made on the basis of improving provider quality and market sustainability, keeping up with any legislation changes, and a number of smaller updates to support the County Council to continue to get best value for money and support savings programmes. The proposal looks at ensuring we have something in place that can ensure we can continue to source the right care for people over the next 10 years. It's therefore important to take account of a couple of things, including obviously the range of services covered as mentioned earlier, also the scale and predicted changes in demand over that time. We also look to take account of both potential inflationary increases and allowing some scope for any further national policy changes that might take place in this space over that same time frame. Over that time period, therefore, the figure proposed is an overall financial envelope of 6.2 billion over that 10 years of the framework. This will cover both the County Council spend and a substantial level of ICB spend over that time, should the ICB wish to make use of that as an option. Therefore, the decision that's put forward as part of this report is that the executive lead member for Adult Social Care and Public Health approve the expenditure up to 6.2 billion under a Help to Live at Home Framework 2024 for a period of up to 10 years commencing 2024 to provide home-based domiciliary care and related services as set out in this report. If approved, it is currently expected that we will be looking to go back out to our provider market over the summer to update them on this next phase in this space, work through the procurement processes required in the latter part of this year, ready to start using the new services and new arrangements in the early part of 2025. I'll open up to questions.
Thank you, Stephen. That's a very comprehensive report. Graham, did you want to say something first of all?
Yeah, if I could, thank you very much indeed. Thank you, Stephen. So really to say, Councillor Fairhurst, this follows rather hot on the heels from an earlier decision you were asked to take earlier this year, which you approved, which is around the care home framework. So it's a procurement vehicle, it's a framework. It doesn't mean we're going to spend 6.2 billion over the next 10 years. What it enables is a financial envelope of up to 6.2 billion. And also, as detailed within the report, enables other public authorities, other public bodies, including, for example, the NHS, to take advantage of this same framework too, if procuring and buying domiciliary services from providers to support Hampshire residents. So I would say it's a really positive development going forward. It gives us and indeed partner organisations a really clear basis on which to procure and hopefully in future purchase domiciliary care that keeps people living safely and independently at home. Thank you.
Thank you, Graham. Yes, I'm really pleased that we're bringing everyone under the same umbrella, like younger adults, older adults. It makes so much more sense to have everyone. I was going to ask, I mean, 6.2 billion is an awful lot of money, but bearing in mind our aging population and the increasing frailty of the people we're seeing coming into our services, is that going to be enough, Stephen? Have you done the maths?
We have done the maths. As you say, the figure is, as Graham correctly says, it's an envelope to work within, not an actual amount, and it builds in a range of things, including, say, expected increases in demand, increases in in requirements and frailty and the wider scope. So, yeah, it should be. And there's also, as I said, the ability for us to flex to respond to any sort of changes either within the market or national policy scale, or changes in local demand and local requirements. So, yeah, it should be.
Super, thank you. Councillor Warren.
Yes, please. I've got a quick question. Stephen, is this service going to be available to every Hampshire resident who needs it, or will it be needs tested, or will people who pay for their care be able to access this framework?
So it's the framework is there to support those individuals who have been assessed as being eligible for adult social care funded support. That doesn't mean, obviously, these providers work very closely with private payers and self-funders as well, and there's obviously a lot of work we do with the providers to make sure that services are available for everyone. But this service is designed to support those who are local authority eligible.
Okay, thank you.
Thank you. Councillor Withers.
I think all the relevant questions have actually been answered, and this we see on a day-to-day basis the requirements of complex needs and living at home, and I'm sure the new government will look at the work that we're doing in the framework we've got for the next 10 years as an exemplary example of how important we place living at home for our residences in Hampshire. So I fully endorse the recommendation.
Thank you. Councillor Benahan.
Sorry, I haven't got a question. It's my hand raised. I do apologise.
That's fine, thank you. Right, Stephen, I think I'm really happy to approve the expenditure of 6.2 billion under the Help to Live at Home framework for a period of up to 10 years to produce home-based domiciliary care and related services as you've set out in the report. So thank you very much. Thank you.
Thank you very much.
Right, moving rapidly on, looking at the time. Rapid Support Service, Hampshire Life Vital from the ICB, and Step Down Live-In Care from the North East Hampshire. Denise?
Good afternoon, all. Thank you very much for your time, and I will be as swift as I can be. This ask is in relation to spend approval for the continuation of 2 hospital discharge services. Both services already exist, but their contracts are due to cease in March 2025. Therefore, to ensure as smooth as possible continuation of service with least disruption to Hampshire residents, we need to start the new procurement and commissioning activity now to ensure those services are in place for next April. The 2 services in question are the Rapid Support Service and the short-term service Live-In Care. Both of these services meet both local and national targets for best practice around hospital discharge and supporting individuals to remain in their own home under a reablement service. Rapid Support Service provides an enabling and re-abling service for individuals within their own home, non-chargeable for up to 28 days, so open and available to all Hampshire residents, which is not means tested. We've supported over 3,500 individuals home from Hampshire in the last year using this service. This works alongside and in conjunction with our pre-existing Hampshire County Council reablement service. The Live-In Care service provides similar service up to 28 days, non-chargeable, non-means tested to the individual, re-abling and enabling, but with a Live-In Care provider in the person's own home. And 600 individuals have been supported in the last year. What we are seeking approval to do is a spend of up to 18.7 million for the Rapid Support Service and 2.8 million for the Live-In Care service to repeat the current contractual cycle of a 2-year +1 contract with a maximum total spend of 21,528,000. This spend also includes the ability to surge the services within the contract to meet winter pressures. As we know, every winter we see those across our systems. These are jointly funded services between Hampshire Isle of Wight ICB and Hampshire County Council, or Frimley ICB and Hampshire County Council, under a pooled budget within the Better Care Fund. And we have written spend approval from both ICBs to move forward with this contract. The services would continue to be commissioned by Hampshire County Council and contract managed by ourselves as well, with a standard report cycle back to both ICB and local authority colleagues. Thank you.
Thank you, Denise. I'm not terribly sure after having heard from you that I actually have any questions to query with you. So I'm going to pass over to Councillor Warren.
Just a quickie, really, Denise. I mean, this is fantastic, and it supports the decision we've just made. How familiar is every member of staff in the NHS with the availability of this service, and is it as well used as it could be? That's my question to you.
So the use of the services consistently sits above 85 to 90% usage, which from a commissioning perspective is excellent. We do our very best to make sure absolutely everybody is aware of the service. Where we work really closely is the transfer of care hubs within all of the acute hospitals, who are the decision makers for discharge. So we have our own teams who sit within those hubs. So therefore we are actively enabling and pulling people out with those services, rather than waiting for the decision to be made.
Brilliant, thank you.
Graham, did you want to come in?
Yeah, if I could, thank you very much indeed, and I agree, and it's helpful, Councillor Warwick, that you referenced the previous report and decision. This is complementary, I think, within the constellation that we operate within. I just wanted to make the point, I presented at Cabinet last week the annual System Resilience Report, which looked back over our hospital discharge activities over the last financial year. And in presenting that report, I was asked the question by one of your Cabinet colleagues, did I have any particular concerns looking forward? One of the concerns that I identified is having enough capacity as we get into autumn and winter. And as Denise has described, this absolutely enables for us and NHS partners to be able to surge, i.e. increase capacity based on the necessary demands that we see. So I think this is just an excellent example of proactive, positive commissioning going forward. So I would certainly be wanting to commend it to Councillor Fairhurst for approval. Thank you.
Thank you, Graham. Councillor Withers.
I totally agree with what Graham said. I think this is a very positive move and fully endorse it.
Thank you. Councillor Benham.
Thank you. At our recent HAS, it was discussed that actually the surge is longer and tends to be more across the whole year. So that winter spike actually isn't there, it's just you're full on all the time. Are you quite confident that those needs can be met if that continues in the current vein? Thank you.
Yes, I am. I think we have these services been running since April 2020. So we have a large amount of data, and Matthew, who works in my team, is on the call here. We have a huge amount of data that we've worked through to understand those peaks and troughs. I would agree there is still a winter surge, but we have a summer holiday surge when carers are on holiday. We have an Easter bank holiday surge. We have a January surge. So yes, we are confident that the flexibility we have allowed enables us to do what we need to do at the right time without overspending or having the wrong service available at the wrong time.
Thank you.
Thank you, Councillor Methan. I'm very happy to go to the recommendations and to approve the spend for the rapid support services and also to recommission the short-term services. And thank you for your time, Denise.
Thank you very much.
Right, now we're moving on to public health spend. Welcome, Jo.
Thank you very much, Councillor Fairhurst. May I just dial in my colleague, Alina Cahill?
Yes, certainly.
Thank you. Oh, here she is, as if by magic. Thank you very much.
Welcome, Alina.
Hello,
Right.
good afternoon.
So allow me just to introduce the paper, then I will hand over to Alina to go through in a little more detail. As you will have seen, the paper is seeking approval to spend to a maximum value of 78 million on our drug and alcohol service it's a public health responsibility to commission this service, and the intention is to have that spend over 6 years.
Thanks, Jo. So just to summarise the paper that you have already seen. So as Jo's already said, Hampshire County Council have had responsibility to commission drug and alcohol treatment services since 2012. We already have a drug and alcohol treatment service in place. The contract is due to expire on the 30th of June 2025, hence permission to spend after this date. Just to summarise in terms of the core components, so what makes up our drug and alcohol treatment service, there's 4 key elements. The first one is a specialist service for children and young people up to 25 years, and that's delivered out in our communities. There is an adult treatment service, which includes both psychosocial and medical interventions, which is delivered both in physical treatment hubs across the county, alongside satellite and outreach provision, working with lots of different partners such as primary care. The third element is support for people that are impacted by someone else's drug and alcohol use, because we know that actually there's often people that are supporting people that are in drug and alcohol treatment, and they could be sort of family members or carers, and they absolutely need the right support. And then the final element is a pharmacy drug treatment service. So that is delivered by our community pharmacies, and basically that provides needle exchange, something called naloxone. So for those of you that don't know what that is, it's an opiate reversal medication that prevents drug overdoses for people that are injecting drugs. And finally, something called opiate substitute therapy, which is for people that are using heroin and want to come off the heroin. So they'll be prescribed methadone as a replacement to enable them to stop using illicit drugs. So that is the core components of the existing service, and we plan to deliver a very similar service from July 2025. Just to provide a little bit of further background, in terms of activity, there's a significant number of our Hampshire residents that actually access drug and alcohol treatment in Hampshire. So we've got about 4,000 adults each year and 800 children and young people that access treatment and support. And probably I'll probably just finish in terms of sort of the national spotlight on drug and alcohol treatment services. When the National Drug Strategy was issued a couple of years ago, there was some very clear indicators about expectations around drug and alcohol treatment at a local level, and we are measured on these in Hampshire, and they are looking at numbers of people in treatment, numbers of people accessing residential rehabilitation, monitoring the number of people that come from the prison, that release from the prison and require drug and alcohol treatment on release, and then looking at reducing our drug and alcohol related deaths. And we're performing very well against those nationally set targets, but it's obviously important that we continue to invest in our drug and alcohol treatment service to continue to meet these. So I'll probably pause there. Are there any questions?
None from me, Alina, because I'm well aware of what a grand job our services are doing at the moment. I'll hand over to Councillor Warren.
Yeah, I've got one just relevant to my kind of profession, and we note the number of pharmacies that are closing, and I just wondered if there's pressure on you to find pharmacies that are willing to take part in naloxone provision and needle exchange programs. Is that changed recently?
So thank you for your question. It is a challenge. However, our current drug and alcohol treatment provider is working really hard with all our community pharmacies, trying to build up a relationship. And I think it's about making sure that pharmacies understand what their role is to play around delivering some of these priorities. So naloxone absolutely can reduce a drug-related death. So actually it's making sure that pharmacies understand what their role is. And actually what we've also done is made sure that pharmacies are getting paid what they should be paid to be delivering these types of services, because that was an issue a little while ago. So we're hoping that continued sort of relationship building will help. So it is an issue, but we are looking to tackle it.
Brilliant, thank you.
Councillor Withers.
No, I'm very impressed with our services and had a recent experience of the support given to Two Saints in Rushmore, working very closely with our own staff, and they do an exemplary job. So I fully support and endorse this recommendation.
Thank you. Councillor Menahan.
It's just an observation if there's anything drilled down. So there's quite a lot of national speak about the young people who are turning away from alcohol. Are you seeing that trickle down into your service? Is it changing where the need is? Is there more young people looking for drug support, or is it not come down to your level yet? Thank you.
At the moment, in terms of young people accessing Catch-22, the main reported substances are still alcohol and cannabis. What we are seeing, which is a little bit worrying, is the increased use of other drugs such as ketamine, which is quite concerning just because of the physical health side effects of using that drug. So we're working quite hard with our provider and also secondary care and primary care to understand how we can support people better if they present to services. But yeah, at the moment it's alcohol and cannabis still.
Thank you.
Right. Well, thank you, everyone. I'm more than happy to give approval for permission for this spend on drug and alcohol treatment and support services. So thank you, Elena. Thank you very much. Jo, I think you're staying with us for public health nursing.
I am indeed staying with us for public health nursing, and my colleague, also named Jo, is also here as one of the authors of the paper to help give it a little more detail if that's required. So this paper, as you will have seen, is seeking approval to spend an additional 20 million on top of the previously agreed amount for the contract as a whole. And the rationale for seeking this additional approval to spend is so that we are able to continue to pay our NHS provider the Agenda for Change pay uplifts that are in part of a national pay agreement for NHS staff on these types of contract. Don't know if you want to say anything else, Jo.
Yeah, thank you, Jo. So just to provide a little bit of context, so this is about the public health nursing service, which involves your health visiting, your family nurse partnership and your school nursing. It's across the county. It provides a universal service for all babies, children and young people and families, and has specialist and targeted levels as well. As Jo articulated, it's an NHS provider. The pay awards are nationally agreed, and then when the money comes into the public health ring fence grant, we can then forward it to the provider. But if the money doesn't come in, then obviously we negotiate changes to contract delivery or activity levels on that basis. So they're in year 4 of the contract at the moment. There's no performance issues or anything else, and the paper doesn't involve anything around future procurement or anything along those lines. It's literally just to ensure that the permission to spend and the ability to modify the contract to enable us to forward that funding to them is the decision we're looking for, really. What was I trying to say? So with the provider, oh sorry, I've lost my thread now. Effectively, it's a service where it's simply about making sure the staff can be paid to the nationally agreed set, because the provider will be paying that anyway. And yeah, I think that's probably it, really.
Thank you, Jo. Can I just ask you, just going off piece for a little while, a few years ago we seemed to be very short of public health visiting. Are we
yes.
up, and are we still, you know, within the right range of having the right numbers?
So there is still a national crisis in terms of these very specialist staff. So it takes 7 years to grow a health visitor because of the level of qualifications that are needed. But the service has been really proactive and really engaged in developing a very strong transformation plan with us. So they've been using skill mix and looking at how we can prioritise the most vulnerable using evidence-based tools to ensure that we're really looking at how we focus where the qualified staff can be. And we're monitoring the impact of that through our routine contract management all the time. We have regular monthly transformation meetings alongside our quarterly contract quality review meetings, and then informal opportunities to connect with the provider should anything arise. So, for example, if there's a pressure point in a particular place, then we can unpick that particular issue with the provider and look at how that's prioritised.
Thank you. And are our public health visitors sort of coterminous with our children centres at all?
In terms of locations?
Yes.
So the way the service is operated is that there's essentially a home visiting service. So they have their bases where they are, that's their team bases as such, and it's not open to the public. They do operate clinic services, so family members or anyone can contact through, they have a chat health service, for example, where their needs can be triaged and they can then book an appointment. And then, yes, those appointments will be held in community venues, which may well be a children's centre, it might be a local library or a hall that's in a central location according to where the needs are, really.
Okay, thank you. Councillor Warren, no further questions? No. Councillor Withers?
One of the things I've come across is the fact it's all right having a national pay increase, but it hasn't covered bank staff. And it's a big issue at the moment with providers that the bank staff are not receiving the pay increase. Have we experienced any problem with our providers?
We haven't actually for this service, because the nature of health visiting and school nurses is that there's actually very few of them on the bank. So it's not they do use NHS professionals for some roles, but actually it's not a big ask for this particular service because it's such a specialist qualification that the bank isn't, they don't exist within that cohort of staff, if that makes sense. So we haven't actually come across that as an issue in our service.
Okay, thank you.
Thank you. Councillor Mayhem?
No questions from me, thank you, boss.
Okay, Joe, thank you very much, and I'm more than happy to approve the recommendations and hope we continue to get enough public health visitors. Okay, thank you.
Thank you.
Thank you. Thank you, Joe. Thank you, Councillor Fairhurst.
Thank you. Right, Joe, it's you again.
It's me again.
Direct travel.
Yep, we're going for the full breadth of public health interventions today. So this third and last paper from us in public health is to seek approval for a total of £500,000 worth of grants to district and borough councils from the public health ring fence grants to enable districts and boroughs to develop and deliver evidence-based interventions aimed at increasing participation in active travel. As I said, the total available would be up to 500,000, with any district or borough council able to apply for a maximum of 25,000 in any financial year. And it would be our intention to, if approved, to be able to start that within this financial year and have the scheme going up to 2028, should that budget allow. However, there would be checkpoints within that whole time frame for us to, assess how well things are going and whether the grants were being taken up and whether the interventions were beginning to show some effect.
Thank you. Have you had a large take up from the boroughs and districts?
There's interest from the boroughs and districts. We've never really used this grant approach before for active travel for this very specific sort of intervention. We have used a similar model for physical activity in its broadest sense, which was open to districts and boroughs, but also to other types of organisation. So with this scheme, we have done some early engagement, and there is appetite to take this forward.
Good. Councillor Warwick.
I'm just going to ask you about the outcomes, Joe, and how you're going to measure those. I guess you don't know what the grants applications look like yet, but what sort of things will you be looking for in your outcomes?
Yeah, thank you. So it's a good question, which give us an indication. They are often done on a kind of sample-based approach so that they're not exact, and then we wouldn't be able to pinpoint them to the particular interventions. However, we would be able to utilise that information more broadly to help us understand if within the lifetime of the whole grant scheme, we'd seen that channel shift. We would be asking bidders for this scheme, so those districts and boroughs, to articulate well how they would seek to measure any change in travel activity within the scope of their particular scheme. Highly likely that they would have to collect data in some regard themselves within their intervention. It might be collecting information from participants about their most commonly used travel mode, for example.
Thank you. Councillor Withers.
Joe, is this being briefed down to the Hampshire Learning Disabilities Partnership? so that they can contact their districts and boroughs?
I am not sure, but that is a very sensible suggestion and very helpful in thinking of helping us to think about ensuring that any of these interventions, target people who perhaps are less likely to be physically active. So we can definitely take that on board.
Yeah.
Thank you.
Thank you.
Thank you. Councillor Menahan.
I've seen the promotion where it talks about gives the odd idea, including lending of bikes, which probably gospel they'd all get stolen, but that's by. Do you have a database of ideas for active travel that local councils could go and look at for inspiration to sort of get their mind and ideas generating? Thank you.
I'm not sure if we have something as what would I say as cooked as a database, but we certainly do have a wealth of evidence-based information that we could pull together and share it in the way that you suggested.
Okay, and how are we sharing that with people who may be interested in applying?
I think the way that we would share that would be, should this be agreed, we would reach out to districts and boroughs in a range of ways. We have within our team, within the public health team, public health officers who take the sort of single point of contact type of role with individual districts. So we would definitely do it through that way. We could do it through the Health and Wellbeing Board, district representatives, and also through Simon's kind of route in where he sits on the district chief execs meetings, for a public health slot. So there are a range of routes we could do to publicise the grants and to share I guess an information sheet with some of those suggestions of the types of interventions.
Okay, thank you.
Right, thank you, Jo. I'm more than happy to approve these recommendations, and I hope that you do get a lot of interest from the boroughs and the districts.
Thank you very much.
Thank you, Jo. Right, Marie, appointments to outside bodies. Yes.
Yes, thank you, Councillor Fairhurst. We have a couple of outside bodies that we have vacancies on at the moment if you're in a position to make any appointments. One is the Portsmouth City Council Health Overview and Scrutiny Panel, and the other is the Southern Health NHS Foundation Trust. As per our protocol, I've contacted the group leaders for the political groups on the council to see if any of the groups wanted to put forward nominations to those vacancies. I've had confirmation that the Labour group have no nominations to put forward on this occasion. I've had no response from the Liberal Democrat group, and the independent group have put forward Councillor Parker Jones for the Southern Health Foundation Trust position.
Thank you for that, Marie. I have had recommendations from the Liberal Democrat group also for Southern Health. I'm just waiting for confirmation of that. So I'm afraid that will have to be vacant this time, but hopefully by September we'll have resolved it and we'll have someone in place. But I'm delighted to say that Councillor Menahan is a more than willing volunteer to go onto the Portsmouth Host.
I think it's Bill, he just wheels me out for everything.
Brilliant. Well
My
done.
pleasure.
Okay, thank you.
Marie? And we will work on the others as well. Okay.
Yes, that's okay. We can hold the other one as a vacancy and pick that up again at the next decision day. Thank you.
Okay. Right, well, thank you all very much, everyone. Graham will be delighted we've finished in time for his next meeting. And thank you to everyone else for attending. Thank you.
Thank you
Thanks
all.
Thank you.
Bye.
Thank you all.
Thank you.
Bye.
Thank you. How did it go? Are you guys happy?